Congressman McDermott, let me start with you. Why is the GOP trying to scare the American public about this law?
Well, Rev, they were scaring the American public for the last 3 years. They took a short break while they shut the government down and made such a mess in the country that they're now got to go back to their same old tune and hope that they can scare the American people into voting for Republicans. How you do that by telling people that they shouldn't get health insurance for their children or for their family or for themselves is beyond me. It is a crazy message that they're trying to push on the American people. They are doing it because they don't want Obama to have any success at all. If it gets in, which it's getting in lots of places, it is going to be the lasting legacy of the presidency, and it will be a legacy for the Democratic Party, and we'll move forward fixing it, and just as we've done with Medicare and Social Security and all the others.
Melissa, you know, what is interesting is we found out yesterday that even though Senator Cruz has been railing against the Affordable Care Act every chance he gets, he also has been trying to pretend he's a list. Listen to this.
Millionaires and billionaires are doing just great. I think in fact, the biggest lie in politics is the lie that Republicans are the party of the rich. The American people are hurting. This is a difficult time. Look, the very rich, they're doing fine.
So he likes to pretend he's this populist. But yesterday we learned he gets his own personal health care from his wife's Goldman Sachs plan. It's a Cadillac plan at that. It's worth $20,000. Now, to put that in perspective, a Texan working a full-time minimum wage job just makes $15,080.
Yeah, look, I think part of what's going on here, I think for me, is a surprise about what this Republican Party is. So I think Ted Cruz is not completely wrong when he makes that point that they are not necessarily the party of the wealthy. And all that I mean by that is that the Tea Party arm of the Republican Party now is actually making policies and is behaving in a way that is in fact not good for the economic engines of Wall Street, of health insurance plans, of kind of all of these sort of big economic interests that we normally would have seen a Republican Party bowing to. So let's just take, for example, the Medicaid expansion in the states. Look, many private hospitals, many doctors and physicians, and much of sort of the economy of many of these states would prefer for those Republican governors to take the Medicaid expansion because they want to be able to serve those additional people. So what we do see is not so much populism, but a kind of ideological rigidity that says we don't care if it hurts people. We are just going to have a very strong and consistent stance that we want government to be so ineffective, so incapable of doing anything that it can't even help people who need the most help.
Well, that's true, but Congressman, part of the reason I played that tape is that they have energized a lot of this Tea Party crowd with this "I'm one of you guys," the millionaires and billionaires, like they're over there, when in fact a lot of those Tea Party members don't know that they are personally, I'm talking about family-wise, connected to Goldman Sachs and others, that some of these Tea Partiers are anti some of the policies that have benefited these businesses. Nothing wrong with these businesses, nothing wrong with your family being involved, but you can't do this and that. You have to do one or the other. You can't rail against things when you know you are in fact part of that.
Goldman Sachs was part of the junta that drove us over the cliff in 2007, that President Obama has been helping us get out of the hole they dug. And for him to be taking his health care from Goldman Sachs and then talking like he's just one of the folks is simply, it's laughable. I don't know how he can do it with a straight face. It really doesn't make any sense at all.
That's my point. And also, Melissa, another thing that I'm very interested in is that they've been all over this myth that the healthcare.gov website costs $634 million. Listen to this.
You pick any big business, if they spent $634 million and it failed this dramatically, why wouldn't that person be fired?
That website, by the way, the original projected cost $93 million. The end cost $643 million. I kid you not.
American taxpayers have spent over $600 million on a system that isn't working.
At some point, Democrats are going to stand up and say, well, we screwed up. We spent $600 million of your money. We had plenty of time to do it, and we blew.
Now, even though the right-wingers are saying this cost $634 million, the nonpartisan Sunlight Foundation says the cost is estimated at $70 million. So here you are, almost 10 times more, projecting an amount 10 times more than the estimate of a nonpartisan group. More of this scare tactics, more of this trying to brush the whole efforts around Obamacare to be outrageous and outsized in terms of what they really are.
Look, I mean, healthcare.gov has some real problems, right? That is one of the things that the administration stood up, took responsibility for. I mean, we've seen this administration over and over again behave in a way that we would expect appropriate, responsible, adult elected officials to behave, which is when the president starts down a road and then says, you know what, I think something is wrong here, as we saw with Syria, and he backed up and he did work with an international coalition and he did work with his own Congress. We know that in this case, they have said very clearly, we've made some mistakes around healthcare.gov. Here is our plan for how we are going to address those mistakes. But there is an enormous difference between talking about the healthcare website and talking about the healthcare law. And so what's happened at this point is that Republicans and conservative commentators have put those two things together and have said, because there are technical glitches on a website, that constitutes a failure of the policy. And that's simply intellectually as well as sort of politically dishonest.
Then, Congressman, don't you feel that they're trying to use the glitches in a way? We had glitches when they had Medicaid under Mr. Bush moving forward. We clearly say that it was wrong or whatever happened in terms of the glitches. But aren't they trying to make that the issue rather than getting health care to the people that need it?
You know, the biggest problem, Reverend, is this. In this day and age, people expect everything to happen right now. They punch a button, they expect something to happen right now. And they have no patience whatsoever. It takes a while to get something like this started. When they put Social Security together, they had 21 million people in this country that they had to give a number to. And the guy came back and said, I can't do it. And they said, yes, you can. Go back and do it. We have a functioning Social Security system in this country that had all the problems at the beginning that this one had, except they didn't have computers. And so my belief is that in 2 or 3 months, you're not going to remember what was going on in October.
Well, the patients you're talking about is the patients that I again say that they asked us to have during Medicaid Plan B under Bush. Seems like maybe we should play some of their tapes to them. Congressman McDermott and Melissa Harris Perry, thank you both for your time.